Many of our physicians have mentioned a need for multi-site trials or centers that are coordinated together so that whether it's a pharmaceutical company or NIH or another entity can come to one person or one body and say, we need, 500 patients in this study, and then it can go in multiple sites. Well, the foundation noticed that was a gap, or was told that was a gap, and we've developed this thing called Clinical Studies Network. It's our CSN. We like acronyms, and I'm going to talk about it a little bit later, but it's exactly like as you start hearing the doctor say, but we don't know, because that's one of the things, that's one of our roles, is we got to fill that, and so that there can be more studies. I'd like to welcome Dr. Leslie Ann Saketkoo. Did I do it? I did it. I practiced. And she is from Tulane University, and she's going to do a health and wellness session for you. And I'll just tell you that you're going to be able to move a little bit, and this is awesome. So, Doctor, thank you.
It's wonderful to be here, everybody. I think I'm going to take this little microphone out of its little tethered, restrictive hold. It's wonderful to be here, and thank you to the Foundation for Sarcoidosis Research for doing everything that they do, because in addition to doing advocacy and education, they have been such an engine and a force internationally, not just in our country, but internationally, for researchers, and to aggregate funding and to put a focus on funding for sarcoidosis. So thank you, Ginger. I get teary-eyed talking about you guys. So my talk today is going to be focusing on aspects of wellness. Sarcoidosis, being a multi-system disease, carries a lot of burden, as you well know. So I'd like to just introduce some concepts and some areas of focus that we can have on our own lives to perhaps optimize how we live and our quality of lives in light of having these symptoms and living with symptoms. So we are adults, we may have kids, we have loved ones, we have responsibilities at work. So we have so many life challenges, and the first thing that we want to do is make sure everybody else is okay. I'm sure that's true of most everybody in this room. But when you have a chronic illness, it's essential to be able to take a moment to get quiet with yourself and find out what you need and try to prioritize your needs, because that's how we can be the best for everyone else and the people that we love most in our lives. So we have to start looking out for ourselves. And so part of my talk is going to be on the 3 pillars of medicine and healing one's self through essential self-management, which is really just about being mindful and paying attention to oneself and one's needs and trying to optimize methods to deliver those to yourself, and being the pilot of your health, and the focus is on you. So most of this hinges on eating well, sleeping well, and moving, despite feeling like we don't want to move. Here's another image to help carry through. So sarcoidosis is a disease of inflammation. It can also be a disease of fibrosis, but its engine is really inflammation, and inflammation has multifactorial effects. We know that inflammatory diseases result in poor sleep, have effects that are hormonal on the brain and the body, results in fatigue, a systemic fatigue related to inflammation. And we know that this improves with resistance type exercise and aerobic type exercise, healthy movement. There's some data out there, I'm not sure how much I buy into it, but some foods may be related to inflammation. This is being looked at with our tax dollars. And inflammation impacts health of the muscle and the bone. So sleep. Sleep is essential. Sleep in sarcoidosis. Many people have problems sleeping, but we know that this is a higher challenge for patients who have sarcoidosis. And it's perhaps twice as likely than the general population. And poor sleep is associated with fatigue, anxiety, depression, and with shortness of breath. So when you're somebody who's living with sarcoidosis, you may be experiencing poor sleep quality from just your state of breathing. Perhaps, has anybody heard of sleep apnea? Did we discuss this? Yes. So this is not uncommon in people with sarcoidosis, and it's an important question mark to keep in your mind if you're feeling very fatigued and having excessive daytime sleepiness. It's also related to anxiety, depression, increased pain. So we know when you don't sleep well, your threshold for managing pain, your brain's threshold for managing pain lowers. And so we feel pain more intensely when we're not sleeping well. So what we get from improving sleep, we improve our quality of life, we improve our cognitive function, we have overall better health, and when we sleep, we're in a better place to make better decisions. And when we sleep and we're feeling better in ourselves, it's easier to connect with other people in the way that we want to connect with other people. And I think that's the thing that's most valuable in the room to everybody. We know that there's a relationship to good sleep and decreased inflammation, and poor sleep and increased inflammation, in addition to the same paradigm with depression, anxiety, stress, coping, and an inverse correlation with happiness on subjective happiness scales, because there is a scientific happiness scale. Does everyone have my little booklet in there? You should be able to find online the Epworth Sleepiness Scale, and you can do this for yourself. And you can look at your chance of dozing to kind of gauge how good your quality of sleep is. And so if you take this little exam, if your score is between 1 and 6, congratulations, because you're getting enough sleep. But if it's not, you want to investigate. In addition to having sarcoidosis, you want to make sure that there's nothing else going on. Breathing issues that might be causing disability like that we talked about. Sleep apnea. Sleep apnea is a very important aspect of pulmonary care to identify if you are a patient with sarcoidosis or any patient with cardio or pulmonary disease, because this is something that's treatable and can make you feel better. This is online. It's called the Stop Bang questionnaire, and you can do this questionnaire and figure out, and if you find that there's something on it that bothers you, you can bring it to your doctor, and they will assess it and send you for a sleep study. And so another reason is anxiety, depression, and pain related to the disease. And then lastly, restless leg syndrome seems to be a bit higher in patients with sarcoidosis. So now my little booklet is all about the it's the little slumber sleep guide. I think I call it, what do I call it?
Slumber guide.
Oh, the Happy Slumber Guide, yeah. Nice. So it basically provides some guidance for better sleeping habits, because in order to engage in a good sleep, we have to pay attention to our routines before sleep. And so you're going to find all of this information in that guide, okay? And we're going to talk about mindfulness in a minute. Did I do that? Yes. So nutrition. So nutrition. Nutrition is important. I don't know where those studies and the evidence is going to lie in terms of types of food and food choices and However, it is essential to make sure that you're getting the nutrients that your body needs in order to provide the immune system with what it needs, the nutrients that it needs to build the armamentarium to cope with sarcoidosis. So, in terms of stress and balance, I'd just like to focus on. You see where we are with time. I'd like to focus on mindfulness. This is the other one, the other booklet that you have, which is called, it has the title, Restore Yourself Wherever You Are. So mindfulness is something that has been studied in great detail, and with a lot of our tax dollars, with a positive bang for the buck, because we know that it impacts several disease symptoms and treatment symptoms, which was first studied in cancer. And we also know its value in addiction medicine, regardless of what addiction it is. But in chronic illnesses, we have to have realistic expectations. We should not expect people to go out there and be meditators. You know, nobody has an hour to spend doing meditation unless you really love it and are drawn to it, and then that's a choice. But what this component of mindfulness is about learning certain skills and planting seeds of being able to engage in these techniques, but for brief moments and when you really need it, and building that muscle. So in other words, it can be an anchor in times that are difficult, challenging, dealing with difficult symptoms. And so again, NIH dollars, since the late 60s, 70s, and as we've advanced medical technology, we've been able to really understand and quantify the benefits on a neurobiological and immunological level, at the level of the genes even, of a mindfulness practice, which we'll do very quickly in a second. And we talked about this already. So what I'd like to do is take 2 minutes and teach really the first 2 pillars of mindfulness. And the first 2 pillars of mindfulness is really just allowing your attention to fall on your body and your breath. And it's not anything that you really have to do. It's just a noticing. So I'm going to ask folks to just take a comfortable seat, and we'll just do 2 minutes together to give you a flavor of it. So take a comfortable seat with your feet flat on the floor if you can. And allow your shoulders and arms to be open, and allow your hands to rest in a comfortable position in your lap. And then allow your eyes to gently soften to either closed or a fuzzy gaze in front of you, whichever's most comfortable for you. And gently allow your hands to move up to your belly and let them just rest on your belly. So you might notice that the belly is rising up against your hand and falling away from your hand. You might enjoy the stretch of the belly as the belly rises into the hand and reaches up, and as the belly falls away from the hand. Just allow your attention to rest on the sensation of the belly rising and falling into the hands. It doesn't matter if your mind wanders, because that's what minds do. Just invite your mind to come back to that sensation and that connection. Now you might want to allow your mind to notice another sensation that happens with the flow of the breath in and the flow of the breath out. Maybe it's still the stretch of your belly. That's fine. Maybe it's the stretch across your back as your breath moves in and your breath falls away. Or maybe it's the pressure of your bottom in the seat as your breath moves in, and then the softening as the breath moves away. Take 3 more breaths in your own time, allowing your attention to fall on the sensation that you prefer. And then when you're ready, you can allow your eyes to soften, to open in your own time. Okay, so those are the first 2 pillars of mindfulness, and it's something that we all know how to do, and we've all done it, and it's all been there for us at different times in our lives when we've needed it. But we can cultivate that muscle so it's there for us more robustly and more immediately. So these were the first 2 pillars of mindfulness training, which is the noticing of the breath, the noticing of the changes of the sensation in the body that the breath creates, and those root us. And that is to manage these types of beauties, these racing thoughts and emotions, strong emotions, which I think I talk more about in the booklet. So it's okay if your mind wandered. Everybody here, my mind certainly does. Did everyone have a little experience with their mind moving away from the task? And that's perfectly fine, because that's where the beauty and the deliciousness of these exercises are. And that's probably why it's known to increase cognitive skills, memory, and executive functioning. So, but you just allow yourself, you be kind to yourself first, and then invite your attention to come back. So the last component of what I want to talk about is movement. It is not something that is easy for anyone with a chronic illness to do, to get up and to move. It also can be scary if you have a cardio or pulmonary problem, or if you have severe arthritis. It can make you scared. But I do want to emphasize that for anyone, and there's all levels of movement, any movement that we do is beautiful and it's healthful for ourselves. It improves, we know this from studies, that it improves brain size, function, work productivity, staves the development of dementia, decreases pain perception. We know that, right? Everyone in this room knows that exercise decreases your perception of pain. It provides better sleep, and it reduces fatigue. And we know that in sarcoidosis patients. We know that thanks to the work of Marlene Drent in the net. So what movement is medicine? Yeah, I don't know. So movement is medicine. So movement is medicine, and when I say medicine, I really mean medicine. I'm not talking metaphorically, because when we move, and it doesn't matter, just the act of standing up, you just standing up, you start to produce a cascade of chemicals and enzymes that start to break down cholesterol. And when we move, the slightest movement, we're producing biologics similars to the medicines we take for diabetes, cholesterol, inflammation, and everything else listed up there. And so, but one important thing is that, I come from a family of large people, especially on my mom's side, and the thought of exercise is something alien to us that belongs to beautiful people, slender people. But in my later life, I realized that there's a connection to it. Just doesn't matter as long as you feel beautiful when you're moving and find something that you enjoy doing. And one of the things that I teach in New Orleans, because we have very severe cardiovascular prevalence and with a high mortality there, and people who don't connect to exercise, teaching dance, and just teaching dance for the beauty of feeling your body moving. And it doesn't matter how light, it doesn't matter how intense, but as long as you're listening to yourself. So safety in movement, listen to yourself, and then you're fine. And this is where the movement sort of dovetails onto our mindfulness little session. Pain is wrong. Pain is always wrong. And you can avoid pain, and I'll tell you how to do that in a second. You should never twist your knees, and moving should only feel good. And if you don't feel good standing, sitting is terrific. It's a terrific place for moving. So safety. How do you know that you're moving safely but still moving in a healthful way? First of all, any movement is healthy. Secondly, you'll know that when you're moving healthy, when achieving a cardiovascular fit level for yourself is when your heart beats just a little faster. You may have just a little glisten of sweat. And when you're moving, it's important to just explore the sensations of different parts of your body, like your shoulders, your arms, and that's all in there. But one thing that I did want to say, which I missed, is that this is a very important part of protection and a very important part of taking pleasure in movement and a very important part of, even for high athletic focus, such as running, is that if we allow the sensation, does this sound familiar? Allow the sensation, connect to the sensation of the movement, which initiates from the belly of the muscles, from the middle of the muscles. So, and it takes a while to connect and to train that thought, but when you do, you keep movement out of the joints. You increase the development of tone in those muscles and develop stability in the surrounding joints. And then it stays pleasurable for you. Moving should feel like a massage. If you're walking, if you're cycling, if you're doing yoga, if you're one of those people who I admire so much who do running, whatever you're doing, it should be pleasurable, and the movement you feel it. You should feel it in the muscle. And so I think that's it. So thank you guys very much. Thank you, Ginger.